From founding Jarrow formulas in the late 1970s to founding the International Probiotics Association in 2001, Jarrow Rogovin's lasting contribution to the probiotics dietary supplements category is there for all to see. He remains an active and outspoken member of the probiotics community, both in the US and globally. He truly is a probiotics champion. So Jarrow, it's great to see you. Thanks for joining us.
Likewise, Stephen. It's good to speak with you again.
So were you interested in probiotics right from the start, or at what point did you become interested in probiotics and the microbiome? Probably wasn't even called that in 1977, but
it wasn't.
Okay,
it's a pretty new name. The whole biome thing is.
Okay,
I mean, bio is becoming. Even that's a more recent. Bio this, bio that. It's fairly new. Relative. I would say it was close to 10 years. It was the mid 80s, 86. Perhaps I think I was becoming interested maybe 83, 84, because I had a health food store for several years. And I was a better wholesaler than retailer. And the retail took all the work. I had no time for the wholesale. And, doing downtown LA produce runs at 3 a.m. was not my great ambition in life. It was not my great interest. I really enjoyed the supplements, the science, the nutrition, how things work. I like to know how things work. So I went on to the wholesale, and it's been a fascinating life. It's a fascinating career. A lot of science, many dozens and dozens, perhaps well over 100 scientific symposia, and I learned a lot.
So did you meet someone? I mean, what was that initial spark around, the probiotics and the acidophilus, let's kind of say, because it was Jarrodophilus, right, that kind of kicked everything off?
There was simply promotion a little bit in the industry. To give some credit, Natron was doing a lot, and I became interested in the idea, the product category, and looked into it, and this is fascinating. And I had I'm pretty sure it was Rick Miriam, which will ring a bell with some of the older folks out there in the industry, old timers in the industry, who was actually originally with, I believe, Global. Not remember the first name, but they actually introduced CoQ10 and Ginkgo. And Rick's partner was, I can't remember Jack's last name right now, but Rick Miriam he referred me to someone named Jean Strong, who lived in BC, British Columbia. And she was an independent sales rep for Institut Roselle in Montreal, Quebec, Canada. And so I thought, the gut is a gemisch. It's a mixture, and it makes no sense to take one species. I mean, obviously, and when you eat fermented foods, kefir and so on, these have mixed strains. So mimic nature, important principle for our industry, something not to get too far away from. Mimic nature, and that was the mixed strain approach. But nobody had done it in the health food stores. It wasn't being done. And so I started with one with five strains, the original Jarrodophilus.
So when did you first meet Dr. Edouard Brochu? Because he's someone, when I've spoken to you before, his name comes up quite often. So he's clearly been someone who was something of a mentor or inspiration or to you. So at what point did you meet him?
It was possibly in 86, when I first introduced the product. Yeah, actually it was, because I remember flying up there, and the first order was $1,900 prepay. And maybe it was, I think, 100,000 capsules. And imagine paying $19 a thousand for probiotics capsules. Roselle was unique in many ways, including they did their own encapsulation. They actually tested before they sent out a batch. And the testing back then was done by something called API 50 CH strips. CH meaning carbohydrate. So these were strips that had 50 wells of different carbohydrates, and a bacteria, the same one, would be put in each well, and it would change color if it was fermented by that bacteria, and it would be for a prescribed number of days, 3 or 4 days, in an incubator, controlled, atmosphere. And that profile of fermentation, they would use that to identify the species. So, for instance, rhamnosus fermented the carbohydrate rhamnose, and that was a favorite of Dr. Brochu's. It's a very rigorous, hardy strain. I also have a certain fondness for, by the way, the species of Plantarum, because it's called Plantarum because it's typically found on plants, because it's able to survive in really harsh and relatively harsh environments. So certain Plantarum strains, for instance, you find them in pickles or on the outside of fermented meats, like a salami. You see that white coating on it. There's a lot of Plantarum. So you'll find different Plantarums able to sort different environments. So they could be on a leaf, in a fermentation, in kimchi, on and on. And it's a very big family. It's a fascinating species. And I think we'll find companies will keep discovering more and more attributes of different strains of Plantarum. And I wouldn't be surprised to see the species get split in terms of nomenclature.
So talk to me a bit more about Gyrodophilis, because that was 86 that you launched that. You said you were trying to mimic nature. You had 5 strains initially. Was there anything similar on the market back then when you launched it, and what was the reception like?
There wasn't. The reception was very good. It was excellent. And it became a big seller. And I was attacked by 2 leading competitors that it was quite pugilistic. They fight each other, they kill each other, they wipe each other out. Of course, they had no data for that. They said it. They sent their reps into the stores to attack. And I got sick and tired of it. And I bought their products and sent them to Roselle for analysis. One which was claiming a certain well-known strain of Acidophilus from the East Coast. We analyzed it and turned out to be rhamnosus laced with what was then called Streptococcus. It's now called Enterococcus, the species, Faecium. But it wasn't this particular Acidophilus. Another one, the company had various bottles, each one is supposedly a different strain. And we analyzed it, and every single one of them was Lactococcus lactis, every one of them. And I got a letter from a lawyer, and I wrote back. But alas, Dr. Brochu finds lots of lactis and a lack of appropriate lactobacillus. And that was the end of that one. That company, called in a consultant from a major manufacturer to clean up the manufacturing, et cetera, et cetera.
Go again. Okay, so I want to talk to you now about the IPA, the International Probiotics Association, which you founded, 2001, I think is the official founding date. So where did the idea come from that? What was the spark? And then also, how quickly were other players to join?
So 2 things. It was twofold. Maybe I should reverse my thinking on an order of influence. Probably threefold, if not 4. First, I had been a member already a good number of years of AOCS, American Oil Chemists Society, which is out of Decatur, Illinois, and it's food oils. It's nothing to do with fracking. And and it's an amazing society. They have publications, they carry other publications, books, they do an annual convention, and it's everything. It's analytics, scientific presentations on all kinds of scientific work, basic science, clinical science, food science, very, very broad spectrum. And then, in the exhibit hall, there's also manufacturers and manufacturing equipment, and in the people who sell the ingredients and processes, all kinds of things. And it's not a huge organization; it's moderate size, and also it's a very warm, friendly, embracing place. It's superb. And my friendship, my menteeship with Dr. Brochu. He was certainly my mentor. And I saw that this is something that has to be institutionalized, has to be passed on. That in the 50s in Canada, he started pamphleteering about the health benefits of yogurt. He came from an old French culture family, so yogurts, cheeses, fermented milks, les laits fermentés, the fermented milks. And as a matter of fact, there was a symposium of that name in Paris in December '89. I attended with him. And there, Professor Roberfoy spoke, and he had proposed symbiotic. So you have a prebiotic and a probiotic together. That's a synthesis. That was his SYN, symbiotic. And so, of course, then I'm going to all these symposiums, different subjects. So so like on the food oils, on CoQ10, the International AIDS Society, all kinds of things. So there should be something for probiotics to do this. Third was the ICQA, the International Coenzyme Q10 Association, my relationship, friendship and menteeship with Gianpaolo Lautaro, who was a leading researcher on CoQ10. He's retired now. And I guess my own intrepid desire to do things, to be a man of consequence. And I saw the need for this and wanted to establish it. And of course, my first approach was to Rosell. They loved the idea. And I had already brought them together with Morinaga, another fantastic company in the industry. We have fantastic companies in this industry. Rosell, Morinaga, Chris Hansen, CSL. These are fantastic companies, and others. The membership, the roster of the IPA is just phenomenal. And Yakult is there. It's really something. DuPont. It's amazing. So I went there, and what happened was we created at Rosell the Jarrow EPS, an enhanced probiotic system. So that was shelf stable, multi-strain, and enteric-coated. First such combination, won the Frost and Sullivan Award. And in it was the Morinaga BB536 Bifidobacterium longum. So this was very unusual because remember, Rosell has been doing the encapsulation on this. So to bring in an organism from a competitor, another company, to collaborate. And I said, this is such a fascinating, wonderful organism with such strong science behind it. It'll help make the product. And it's been a wonderful collaboration. So then naturally, it would be Jarrow, Rosell, and Morinaga. And that was the first three. And I believe the next was Chris Hansen. And, then it was, the world was beat a path to the IPA store.
Yeah.
And it's been a wonderful experience. Jarrow Formulas is actually, I'm quite certain of this, carries probiotics from more companies, more parts of the world than any other company in the world. So I like to say the world is my probiotic oyster. And I have sold the company. I'm retired, semi-retired, very semi, but I'm also retained as chairman.
Okay.
So I'm there as chairman and consultant, and I remain on the IPA board.
So when you look at the probiotics industry today, what are you most proud of?
Founding the IPA.
You are.
Absolutely. Among other things, I really believe they're the most respected trade association by the FDA. They deal with a lot of trade associations. And my very strong sense of it is that they feel that all they get from IPA is straight talk, straight science. And now I think it's October, yes, until this virus attack.
Yeah.
There would be a symposium in Bethesda, Maryland, which is where the FDA is, of the IPA, so the FDA can attend, and they always do.
Mm-hmm.
I mean, the whole thing is really, really quite exceptional. Now, the Deshay and supplements and all that, dietary supplements are actually American folk medicine. We hear about traditional Chinese medicine, Ayurvedic medicine. You have African herbs, Arabic culture herbs, American Indian herbs, et cetera, et cetera. Well, dietary supplements is the American folk medicine. And it's a fascinating one because it involves a lot of good science. We have scientific tools today, scientific training. We can even look at other, and it incorporates from the other traditions, tries to find out more specifically how it works, what doesn't work, what it can be combined with, where there's data. And very, very, very important, we have a regulatory framework, Deshay, that's rational. Europe is completely irrational and restrictive, and it's terrible, absolutely terrible. America has a pretty honest, rational regulation. It's extraordinary, and it's actually allowing the science, the category to develop. And the idea is you have two models, which is if it's not forbidden, it's permitted. And America's more like that. The other model is if it's not permitted, it's forbidden. And that's very European. And it's very hard to get around that. And with the NDI process, there is a certain danger. If it's not permitted, it's forbidden. We have to be careful how that the new dietary ingredients, the way it's run, that it's reasonable, it's rational, it's not over restrictive, it's not over expensive, because then that kind of burden, it becomes just automatic restriction, and obviously that's not good. It's not going to work.
Yeah. So last question for you. What comes next for the probiotic category? Like specifically for probiotics, what comes next, do you think?
Oh, that's lots of stuff. Analytics. DuPont's doing, Buffy over at DuPont is doing, and her team are doing fantastic work looking at how to analyze these mixed culture products. That's very important. I think that these super high count, super high mixture products, I'm, shall we say, skeptical of them. There's no sign, except for one product. There's absolutely no science backing this whatsoever. There have been studies showing that you take a a clinically documented strain and you put it with a bunch of other stuff, you negate its clinical effect. Right? So there's a lot of foolishness there. There's one company in particular who did a lot of damage with, this by kicking off its super success with megadosing. And I think it was very damaging, really, to the category. Because when you look at clinical trials of clinically documented strains, 2 billion, 5 billion, 10 billion, it's not 50 billion. It's not 100 billion. This is not accurate. The other thing, what is the effect on the flora of having such massive amounts of a particular class? When you look at the flora, there's 1,000 species, whatever it is. I mean, it's enormous. When I started, they thought that it was 300 or 400 species, and I think at the most we have 1 to 3 trillion organisms in the gut. Now it's an adult gut. It's looking more like 100 trillion and 1,000 species. We didn't even have the tools back then. And a lot of these species, they can't grow them outside. They haven't figured out how to culture them outside the gut. So it's sort of in situ identification of the strain by molecular techniques. But they can't really isolate and culture a lot of these strains yet. And we are at a tremendously sophisticated stage. And still, some of this evades us. Interactions, all kinds. Prebiotics has barely scratched the surface. What is an ideal prebiotic with a certain probiotic? There's been very little work on the specificity there. What about there's been much more work on probiotic having clinical effects, but not prebiotics. And the symbiotic, what pro-pre combination would have an even better effect, say, against IBS. Again, we don't know. Or for mood, we don't know. There's got to be something more to be discovered about colorectal cancer, and what particular things can we do on that? What will ultimately be the scope of what's an acceptable probiotic? Generally, the FDA wants it from the diet, but bifido aren't really dietary already. And is this going to be RX? Is it going to be OTC? How hard will it be to get these approved? We don't know. There's also phages, which are in a netherworld between bacteria and virus. And these also could have fascinating effects against diseases. So there's a tremendous field of the microcosm ahead of us. The microcosm is a sort of hologram of the macrocosm. And Dr. Brochu would say when he looked in the microscope, he would see a universe.
That's a very poetic finish. Thank you,
I
Jerry.
like my poetry.
Thanks so much for taking the time to talk to us today. Really appreciate it.
And I greatly appreciate this, Stephen. It's history is important. My dad was a history teacher. And what you're doing to preserve these decades of this history, I hope it stays in good stead and inspires someone else to say, this is what I want to study. This is what I want to work at. This is a product I think that will, combination that I think will benefit others.
All right. Thank you so much. That means a lot.
Thank you, Stephen.
Take care of yourself, Jarrow. Good luck with your retirement.
Semi.